The Ice Hockey Summit Action on Concussion was put together because of our concern about the apparent increased risk of concussion in the sport of ice hockey. So we thought it would be important to bring together experts from a variety of disciplines in order to put together an action plan. So our summit involved physicians, scientists, athletic trainers, coaches, officials, administrators, and even representatives from the hockey equipment companies, so that we could discuss the latest science, but also break up into smaller groups and address action items that we then prioritized going forward. As a result of the summit, we have some committees who have now taken it one step further. And the areas we're focusing on include databases and metrics, recognizing, diagnosing concussions, management of the concussed athlete and return to play guidelines, equipment, boards, things like that that the athletes have to deal with when they play the sport of ice hockey, and also rule changes and enforcement of existing rules, as well as communication and education of coaches, players, parents, athletes, and officials. And we've seen some important changes already. For example, Hockey Canada and USA Hockey have looked at head hits. One of the prioritized action items of the summit was to eliminate all head hits, make even an unintentional or accidental blow to the head a penalty, with the hope that we can reduce this mechanism of injury and hopefully there will be less concussions in our sport. Well, we were very fortunate that we put together a faculty of world experts on concussion, and we were very impressed by the way they embraced this summit. They all accepted the invitation, they came, they shared their knowledge, they sat down in small groups with the real stakeholders. There were coaches, officials, administrators who took part in debate and discussion, which helped us come up with these action items. And we had everybody from neurologists to epidemiologists to hockey doctors and hockey officials and hockey coaches and sports scientists, engineers, helmet manufacturers, people with a vested interest in the health and safety of our young athletes. I think in addition, we want to monitor some of these action items. For example, USA Hockey at the annual Congress in June has approved a new program. It's actually a body checking educational program where athletes will be involved in contact at a younger age. They will learn the skills of body control and body checking before they're allowed to actually perform body checking in games. So a big part of this program is education, coaching, and skill development, and one component of it is delaying legal body checking in games until age 13, which is the bantam level. Now that that's been approved, we will try to study the effects of this new program and this rule change, and hopefully we will see that the risk of injury in general, and specifically the risk of concussion, is now reduced.